My name is Richard Harris. I'm a vascular and endovascular surgeon here at the Sydney Adventist Hospital. So traditionally, vascular surgery was an enormous open surgical specialty where we did enormous cuts on people's legs and abdomen to get to major arteries, to replace them with grafts and sew them in. And puncture surgery or endovascular surgery has completely revolutionised the way we treat people. And so basically it involves day-only procedures or overnight stay procedures where we're going in through a ultrasound-guided puncture into an artery and dealing with the problem inside the artery rather than having to cut down onto the vessel to repair it. So we can do procedures to arteries with the new equipment that we've got here that we had to do with great big open surgery in the past, which used to involve many weeks of recovery. Probably the best example is aortic aneurysm repair. That used to be a couple of nights in intensive care, at least a week in the acute hospital, and often some rehabilitation over a few-week period, and really getting back to life over a 3 to 6 month period, whereas now we do that with a stent repair, largely invented in Australia. The early stents were invented here in Australia, and we've been putting them in here for around a decade. But that's revolutionised how people recover from aortic aneurysm surgery, and they're home usually in a day or two after the surgery now, and have better outcomes in terms of getting back to work and just getting on with their lives. So over the years, the technology around doing the endovascular procedures has just got better and better and better. And fortunately, with the SANS hybrid theatre that we've got here now, it really is giving us an incredible clarity as to exactly what we're doing with each procedure. So we can place stents exact to the millimetre. We can measure to the point of a millimetre to exactly work out what type of stent, what type of procedure is best for dealing with that particular arterial problem. The type of anaesthetic that's used for vascular surgery is a lot less in terms of the amount of time and the amount of actual anaesthetic that's required to do procedures. Some procedures are done under sedation and local anaesthetic, and some people are very curious to see what we're doing and can watch the screen as we're delivering coils into pelvic veins, for instance. And other people don't want to know about it and just want to have a nice little snooze for 15 minutes while we're doing the procedure. So it does vary how the anaesthetic's delivered, and that's very much discussed between the anaesthetist and the patient. But most people can expect to be going home either that day or the next day after most of our procedures these days for vascular surgery. The hybrid has really made it much easier to do these minimally invasive procedures.